I'm Courtney Terrio in Edmonton, and cannabis is set to be legalized in Canada as of July 1st, 2018. Ottawa has previously laid out much of the ground rules and said that they will look after both health and the criminal code. That means that the provinces and territories will be responsible for such things as sales, enforcement, and road safety. With just 250 days to go before that deadline, many of the health ministers have said that July 1st deadline is, in fact, perhaps too ambitious. So, today, the federal health minister met with her provincial and territorial counterparts here in Edmonton to try to clear some of the haze about those lingering concerns.
Again, we recognize that if we don't do the work that needs to get done and if we didn't bring people together, that we were going to be delayed. So we started off immediately in making sure that we were developing a plan. We've been working closely with provinces, territories, municipalities, and police forces to ensure that we get this done right.
Although we know that for some aspects there are challenges, for instance, awareness campaign most of the time will take time to have a positive effect. We need to have that as soon as possible, and I think that Minister Petitpas-Taylor is really working in that direction.
While marijuana topped the discussion today between the federal, provincial, and territorial ministers at this session, there was also discussion when it came to other pressing issues.
This morning, we were pleased to meet with representatives of the Assembly of First Nations, the ITK, and the Métis Nation to explore health priorities of First Nations, Inuit, and Métis, who continue to experience significant health outcome gaps compared to non-Indigenous Canadians.
Today wraps up the two-day session between the provincial and territorial health ministers, and they covered quite the gamut during this session. Everything from discussion on a national pharmacare program to the need for more mental health care dollars, along with strategizing how to tackle the growing opioid crisis. The hope is by having the federal health minister here for this last part of the session, they'll be able to encourage Ottawa to take a greater role in these discussions going forward. In Edmonton, Courtney Terrio, City News.